Hi folks, it's Marvin Music with MedicareSchool.com, and we want to welcome you to Medicare Monday. Of course, it's Tuesday today because of the 4th. We had to move it to today, but hope you had a great 4th of July weekend. I got to be with the extended family. My wife and I enjoyed time with family. Hope you did the same. We actually played some games over the weekend, and I love to play games as long as I win, and unfortunately I did not win, so that did not go so well, but it was a great weekend. And hey, I want to kick off tonight by letting you know as we sign on here and people join the group, that if you have any questions or any comments or anything like that that you'd like to share with the group, if you'll post those, we would appreciate that. And sometimes people give us some great ideas for topics that they would like to cover. And we're certainly open to suggestions, so anything that we can do to really assist you as you're going on Medicare and trying to learn about Medicare. And I know there's lots of questions, so if you'd like to post some of those. In studio with me is Daniel, who's with our company. And so we probably won't be able to answer all the questions, but if you have some that we can't answer, certainly post those, and we'll do our very best this evening. And also, just before I get started, I want to remind you Terry Yancic is the one who is really in charge of our community here. Terry's very knowledgeable, and she will respond to your questions and try to be of any kind of assistance that she can. She really is very sweet and really a servant, so I know she'll be available for you as well in the future. All right, so I do want to kick off tonight with the two questions that I always ask, because I think it's very important to have really the right mindset as we get into these subjects on Medicare Mondays. First off, do you have to know everything about Medicare in order to make good Medicare decisions? In other words, do you have to be an expert before you can have confidence that you're making the right choices? And the answer obviously is no, you don't. But do you need to know some things about Medicare in order to make good Medicare decisions? And obviously the answer is yes, you do. And really that is the goal of these sessions, to make sure that I had the opportunity to share with you things that I think are really critical. I've been in this business a long time and love doing what we do as a company. But we want to make sure that people really are informed and you make a good decisions. In fact, when I look at agents, that's how I identify a good agent. First of all, that they're very helpful, that they want to do everything they can to make sure they assess people's situations so that as they give Medicare advice, they're giving great advice. In fact, I met with our agents today and told them, listen, don't ever tell someone something that you wouldn't tell your mom to do, because people are making very important decisions. So anyways, that's really what our goal is, to make sure that you understand what you're doing before you make any Medicare decisions. No pressure. We want you to really, really learn. So tonight, we're going to talk about one of those essential topics that is very important, because this particular topic tonight, if you do not do things correctly, you could really have some terrible financial situations that would arise. So tonight, what I'm going to talk about this issue here, and that is how to navigate the 6 Medicare enrollment periods correctly. We're all going to have to deal with enrollment periods, so you need to know how to navigate them correctly. And the reason for that is because if you don't, you're going to have penalties. And we don't want you to have penalties, all right? So we're going to get into this subject tonight. I'm going to talk about each of those and then some of the details. And again, if you have some questions, Daniel will let me know, and we'll be happy to answer those either tonight or very, very soon. All right, so let's get started. First off, enrollment period. What's that even mean? Well, here's Marvin's definition. I actually put this PowerPoint together with Daniel today, and so this is my definition to you in regards to enrollment periods. What does that actually mean? Well, first off, it is a specific period of time when Medicare enrollments can occur. Okay, I mean specific period of time. You cannot just pick and choose when you want to go on Medicare and when you want to buy insurance. Medicare is really already determined times in which you have to do this. So that's what I mean by a very specific period of time. Now, that specific period of time could revolve around your birthday. It could revolve around your employment end date. It could revolve around your retirement date. It actually could be a date that Medicare has set for the whole entire Medicare community, as you'll see tonight. But I want to make sure you understand, when I talk about enrollment periods, it is a very specific period of time, so we have to take action during that period of time. This is when we can begin to do enrollments that are required by Medicare. All right? So that's the definition of an enrollment period. Now, as we look at enrollment periods, the way to understand them the best is to understand that there's really 2 broad categories of enrollments. You're going to see that there's a lot of companies and there's a lot of plans, but really when it all boils down to you getting enrolled into those plans, and applying for those plans, it all boils down to only two different categories. Number one category is enrolling into Medicare A and B, meaning you've made the decision to go into Medicare and you're going to start using your Medicare benefits. Okay, so that's getting the red, white, and blue card. All right, that's a set of enrollment periods you'll see here in a few minutes. There's actually 3 of those opportunities to get into Medicare. Those are called enrollment periods. The second broad aspect of Medicare enrollments would be getting other insurance products. It is very rare that people are going to have Medicare A and B alone. There's just too much risk for people to have A and B alone. And so most people are going to get other insurance. They're going to buy it from private health insurance companies to go along with their government A and B. And so we have the opportunity to be able to buy plans when we go on Medicare, and then also to switch plans. So again, when we talk about enrollment periods, these specific periods of times where we can enroll and we can actually do something with our Medicare benefits. So either we're getting into Medicare A and B to get enrolled into Medicare A and B and get the card, or we're buying other insurance products. And those are supplemental plans, advantage plans, and drug plans. We'll talk about our enrollment periods for those. All right, so I'm going to tackle this first subject here, just getting enrolled into Medicare A and B. Now, we actually have 3 different opportunities to be enrolled to A and B, and 2 of them are wonderful, and 1 of them is terrible. And so I'm going to focus on the first 2 that really are good opportunities. And the first opportunity to get enrolled into Medicare is called the initial enrollment period. And what I want you to learn from this tonight is this, that this is the enrollment period if I'm going to start my Medicare at 65. Okay, which means I'm going on Medicare when I'm first eligible, and this is typically your birth month. So it's our birth month that we turn 65 that we're going to be eligible for Medicare. Now, the exception to that would be if you're born on the first day of any month. So let's say my birthday is July 1, 1957, just had a birthday. Well, my Medicare actually would have started, eligibility would have started in June. When we're born on the first day of the month, they always start us the previous month. But if we're born on the second day thereafter, it's always our birth month that we turn 65 that we are now eligible for Medicare. And so as long as we have 40 quarters paid into Medicare, or our spouse does, we're eligible to enroll into Medicare at 65, called the initial enrollment period. Now, what the key to this enrollment period is to know that it is limited. Remember what I said? It's a certain specific period of time, and that is for 7 months we have our initial enrollment period. And those 7 months are tied to our birth month. And that would be 3 months before we turn 65, the month we turn 65, and then 3 months after. And so we have 7 months to enroll in Medicare at 65. And the month that we choose to enroll will determine when they start our benefits. So if I enroll anytime 3 months before my birth month, my Medicare always starts on my birth month. But if I wait, then Medicare is going to delay my coverage. And so if we have to start at 65, yes, we have 7 months to do it, but it's best to do it during those first 3 months. Now, let's talk about who it is that must start Medicare at 65. It's this: anyone who they or their spouse turning 65 when you're covered by a retiree insurance. Retiree plan, meaning you or your spouse no longer working. You're going to have to start your Medicare at 65. Now, pretty simple if you're on Social Security, because if you're on Social Security, they automatically enroll you into Medicare A and B. They know you're receiving retirement benefits from Social Security, so they assume that you're ready to start Medicare. And so what happens is Social Security, along with Medicare, uses that initial enrollment period to enroll you to Medicare, and they mail you the A and B card. And if you don't have a group plan available, you or your spouse, you're going to keep the Medicare card and you're done with your Medicare enrollment. But if I'm not on Social Security now and I have to start at 65, I have to initiate this, and what I have, 7 months to do it. And so if you're on a retiree plan, or if you're on COBRA insurance, or your spouse is and you're covered by that COBRA plan, you are going to have to start Medicare at 65. And the reason for that is because that COBRA insurance only pays second to Medicare once you're eligible. So again, anyone on a retiree plan has to start at 65. Anybody on a COBRA plan has to start at 65. Now, you may want to keep the retiree plan. Sometimes people do that, sometimes not. You may want to keep the COBRA plan for a certain limited period of time, but you have to enroll into Medicare. Anyone that's covered by an Affordable Care Act plan, that's the ACA plan. You went through the healthcare exchange to set up an insurance individual plan with them. Again, you're not going to keep the ACA plan once you're Medicare eligible, because all the subsidies, all the cost sharing, all those things that made that ACA plan really workable for you are going to be eliminated. So you're not going to keep ACA, you're going to go on Medicare at 65. And then the last group that must enroll at 65 are those that are still working or their spouse is still working, but they are covered by an employer-provided plan that has 19 insureds or less. 19 insureds or less, Medicare takes the first payer position, and then your group plan would pay second. So that's the group that has to come in at 65. Those are covered by retiree plan, COBRA plan, ACA plans, or small group plans, all right? Now, those of you that are still working or your spouse is, and you're covered by a group plan of 20 or more, you don't have to enroll into Medicare at 65. Now, there are some people that will make the decision to enroll in A only, and they don't take B, but they take A. And this is a fine decision with one exception. If you or your spouse are still working, covered by a large group plan, and if you have an HSA, which is called a health savings account, not flexible spending, not health reimbursement arrangement, but a true health savings account, and you're contributing money to that. If you actually enroll into Part A, you have to stop contributing to your HSA. So if you or your spouse are working in a large group plan, 20 or more, you don't have to do anything with Medicare whatsoever. Now, if you do A only, just be sure you're not contributing to an HSA. So the whole point is this: some people have to come into Medicare at 65, and they're going to use their initial enrollment period. Okay? All right, so that's one of our 3 opportunities to get enrolled into Medicare, called the initial enrollment period. Now, the second one, and this is something about half of all people use coming into Medicare, and this is called the special enrollment period. Now, this enrollment period, again, we're talking about getting enrolled into Medicare A and B. This is for people that did not take at 65. In other words, they were eligible at 65, but they didn't take. Why? Because they or their spouse were covered by a group plan of 20 or more, and they didn't need to take their Medicare benefits yet. All right, so they're beyond 65 years old. So this is people that are, 66 or 69 or, or older than that, and now they're going to lose their group plan. They're going to retire, or maybe the group plan is no longer any good. They don't like that coverage, and now they're going to go on Medicare. Well, they can't come in using the initial enrollment period because that only lasted 7 months around their 65th birth month. So now they're beyond that, and now we're going to come in using this special enrollment period. So again, people that were covered by a group plan are going to come in this way. So what we do with this procedure is this. First off, we can start an application for Medicare online, but we cannot complete it. And this process requires 2 different documents. One is called an L564, and the other one is called the CMS 40B. And so these 2 documents were not required when we came in during the initial enrollment period, but when we're coming using special, we have to have these forms filled out. Your HR department, your employer's HR department, will actually fill out the L564, and then you will do the 40B form. Now, by the way, if you work with us, we're happy to do all this for you. But the L564 is a form that we have to get to the Social Security office to prove to Medicare with Social Security that you have been working, your spouse were working, and you had coverage all the way back to age 65. And sometimes we have people that have had changed jobs after 65, and we actually have to have 2 L564 forms. But the point is we have to verify credible insurance, employment, and credible coverage all the way back to 65. And then the 40B form is used to specify when we want to start our Medicare. So let's suppose that someone is working, they're going to retire at the end of this month, and their group plan at work is going to end July 31st. We would put on the 40B form, please begin my Medicare August the 1st, 2022. So we specify the date we want to start, and we verify that we've had credible coverage all the way back to 65. And with those 2 documents, and again, we can start the application online, but these 2 documents have to be faxed in or mailed in or dropped off at a local Social Security office, and that will bring us into Medicare. No penalties, no problems whatsoever using the special enrollment period. And again, this is available for anyone who they or their spouse were working and actively working covered by a group plan of 20 or more. This is how you would come into Medicare with no penalties or no problems. All right, and so that's the second enrollment period. That's a good one. Initial is good for those who are starting at 65, and this one then would be good for those that are not going to start at 65. We're going to keep on working. And then we have one more enrollment period called the general enrollment period. And this again, getting into Medicare. Now this is the one I don't want you to use. Anyone who's using this one, basically what happened is they had the IEP, they missed it. They had an SEP maybe, and they missed it. In other words, these are people that missed the other two enrollment periods, those opportunities, but Medicare says as long as you have 40 quarters, even if you miss these, you can come in at a later date using the general enrollment period. Now this one has problems though, because number one, we can only enroll the first quarter of the year, which means January to March. Now presently, today, it's July the 5th. If someone would have done this earlier this year, we enroll the first quarter and they start the coverage July 1 of that year. And next year in 2023, they're going to change the rules. So we can still only enroll in January, February, and March, but whenever we enroll, they start us the next month. So next year, if we enroll in January, they'll start us in February. If we enroll in February, they start us in March. If we enroll March, they'll start us in April. And so this is going to change in 2023, but we still have limited enrollment. You cannot enroll using GEP anytime from April to December. It's impossible to do that. So when people make a mistake, hopefully they found it early on where they can make this enrollment period during that time. And then another problem we have whenever we use GEP, for every year that we're late, they add a 10% penalty to our Part B premium. Right now, that's $170.10 a month. So there'd be $17.10 a month added to the Part B premium for the rest of your life. So that's why I'm saying we don't want to use this one. People mess up, it's one available, but it does come with penalties and problems. All right, so all three of those are the opportunities that we have to get into Medicare A and B. Now, once we've actually enrolled into Medicare A and B, now we can look at our second group of enrollment periods, and this has to do with buying other insurance. Supplemental plans, drug plans, advantage plans, these other insurance products, because most people don't want the liability of having A and B by itself. All right, so let's talk about now other insurance products and the enrollment periods that go with that. So we're talking about this one right here, buying or switching Medicare insurance. So first off, when it comes to Medigap policies. Now, Medigaps are also called Medicare supplemental plans. These are the plans that work in conjunction with original Medicare. Remember, Medicare A has 3 gaps, and Medicare B has 3 gaps. Gaps just simply mean these are your financial liabilities, your exposure. These include deductibles. These include co-insurance and co-pays. So Medicare pays first, but other than preventive, they don't pay anything 100%. So the balance of those bills are your responsibilities. So we have 3 financial responsibilities on the A and 3 financial responsibilities on the B. So the majority of people that stay in original Medicare don't like these gaps. They're very significant. And so you can take those gaps and you can actually transfer those gaps or transfer that liability to an insurance company. And that insurance company will issue to you a Medigap policy or a Medicare supplemental plan. Now, I'm not going to get on all those tonight because I don't have the time, but most people today are buying Plans F, Plan G, and Plan N. Those are the most common plans today. But here's the point. When do we do this? When do we buy them? Well, the best time to buy any of these supplemental plans is either 6 months before your Part B date or 6 months after, because during that window where there's no underwriting whatsoever, we call this the Medigap open enrollment. So let's suppose that someone's B date, let's say they're going on Medicare A and B and they have a date of 7/1/2022. Now we could apply 6 months before, some companies even a little bit sooner than that, but our coverage doesn't start till here. So we have 6 months before that we can apply Medigap open enrollment, and then 6 months after that date where we can still apply and there's no medical underwriting. So in this example, we'd have all of July, August, September, October, November, and December. And that would mean in January 1 of 2023, from that point forward, in most states around the country, now we have to medically qualify to buy one of those supplemental plans. But during this 6 months before, 6 months after, there's no underwriting allowed. They have to take your pre-existing conditions. They cannot ask you any health questions. And that's why this Medigap open enrollment period is so crucial, especially for people that have health problems, because now they may never get, in some states, they'll never get a Medicare supplemental policy ever because they have to go through underwriting, and if they have serious health issues, that application will be denied. But during the 6 months before, 6 months after B date, that insurance company has to write that policy. All right, otherwise you may never be able to get one of those. So that's a very important period of time. A lot of people think that because Medicare has this open enrollment season every year, that they can switch plans and just move around and do whatever they want as those there's no rules, and that is not true. This rule here is a very important one, especially for those of you that have some health issues. You may never get a policy beyond that possibly. All right, so that's getting supplemental policies. Now, the next next way that we can actually have insurance would be through what's called Advantage plans. These are also called C plans. So this is someone who's made the decision they don't want to be in A and B with the supplemental plan. They don't want to go that direction. They want to go the other direction, which would be a Medicare Advantage plan, which is a private health insurance company that puts together a network of doctors and hospitals and pharmacies and a series of copays with an annual max out of pocket and sometimes some additional perks. But that's an insurance package offered by a private health insurance company. We call these replacement plans or C plans. So again, we're talking about opportunities to buy them. When do we do that? Well, first off, we can actually buy one of these C plans when we turn 65 during our initial enrollment period. You're eligible to buy one at that time. There's no underwriting required whatsoever. And then if we retire later, we're 66 or 69, we can also buy an Advantage plan during a special enrollment period. Meaning this, and that we use the code LEC. This means that you lost employer coverage, and so once we've lost that employer coverage, we actually have 63 days to bring you into a Medicare Advantage plan. I wouldn't suggest waiting that long. I would have all these arrangements made right when you retire. We believe there should be a very smooth transition from the group plan into whatever plan you decide. So if we know my coverage is going to end July 31st, and I want my Medicare to begin August 1, I do all this in advance, and we can do the very same thing when it comes to Advantage plan. We can do those in advance, or we can wait up to 63 days to get that Advantage plan if we're going to buy it initially. All right, so those are enrollment periods to buy plans. Now, when it comes to switching plans, there's actually 2 times a year that we can switch our Advantage plans. The first one is called the AEP, which is the annual election period, and this is October 15th through December 7th. Now, what you have to remember about Advantage plans is they are 1 calendar year. So if someone started a plan this month, July 1, it is their plan all the way to the end of the year, 12/31 of 2022. It's a calendar year plan. But if I ever want to switch the plan, I have to make that decision before the end of the year. So Medicare gives us the 7 weeks where we can switch Advantage plans, and you actually can get any Advantage plan that you want that's available in your zip code. There's no underwriting required. You just have to be enrolled in Medicare A and B and pay your B premium, and you're eligible to enroll in any Advantage plan. So we make the switch during these days, October 15th, December 7th, so the plan we're on carries us to the end of the year, and the new plan will go effective January 1 of the following year. So that's one time in which we can switch Advantage plans to begin January 1. The other opportunity is the first 3 months of every year. This is called the OEP, and this is January 1 to March 31. All right, now here's the key to understanding this particular one here. No one can buy a new Advantage plan during this period of time. They actually have to be covered by an Advantage plan on January 1, and that allows them then to qualify to switch those plans. So let's say they made a decision, they're unhappy with it, but they're on a new Advantage plan. Anytime the first quarter, they can switch Advantage plans. Actually, one time you can exercise this right. And if we make that decision to switch in January, it starts in February. If I make the decision to switch in February, it starts March. March is going to start in April. So we have these 3 months, but we must be on Advantage plan come January 1, and we have the opportunity to be able to switch one more time. All right, so that's switching those kind of plans. So those are C plans called replacement plans. All right? Now, just one more, and that is prescription drug plans. Prescription drug plans are, of course, Part D plans. These are plans that, there we go. These are plans that either were included within my Advantage plan or it was a separate Part D plan. All right, so keep this in mind. I'll make it simple. If you have an Advantage plan that we talked about a few minutes ago, we talked about buying them and switching them. Within that Advantage plan is a drug plan that's embedded. And so if you switch your Advantage plan, you're also switching the drug plan. So those two go together. So what I want to talk about here, this is someone who decided to stay in A and B, original Medicare. They got a supplemental plan Remember, probably an F plan, a G plan, or an N plan. Okay. Then what happened is they actually added a Part D plan. They added a prescription drug plan, and these are called separate policies. And so in this scenario here, what can happen? We can actually buy that when we start Medicare at 65. We can buy that if we retire at a later date and we come in using the special enrollment period. We can add a drug plan. Again, we use the code LEC, which means we just lost our employer coverage, and we're eligible to do that up to 63 days after we lost our coverage. Okay? And so we can buy them at 65, we can buy them at retirement, or when we lose our group plan. All right, so that's purchasing them. But also, drug plans are like Advantage. These only last 1 year. All right, so again, we have this opportunity once a year to switch drug plans. And those dates are like the Advantage plan switches. October 15th through December 7th. We have 7 weeks. So what happens if I'm on a prescription drug plan right around this October 15th date? The insurance company sends me a packet of information. We call that an annual notice of change. And they're going to let you know what they're going to change in that plan for the coming year. They may change the premium. They may change the formulary. They may change the preferred pharmacy. They may re-tier medication. So there could be some changes that could have a negative impact on you. So what we can do is during this period of time, we've seen what the plan is going to look like. If we don't like it, then we can go back to the drawing board and we can pick out a brand new drug plan for the coming year. So we're on the plan through December 31st. Our new plan will kick in January 1st. And again, we'll be on that plan for a calendar year. So we can buy them at retirement or at 65, and we can switch them every year if we need to do so. Most people don't, but you need to make sure that that plan is going to suit you well for the coming year. All right? And so those are the enrollment periods. Now, here's what happens. If you go on Medicare fully, A and B, and now it's time to get a drug plan, if you do not add a drug plan, then you're going to be penalized. There are a lot of people today that take very cheap meds or maybe no meds, and sometimes they'll say, I'm not going to get a drug plan, I don't take any medications, my drugs are cheaper through GoodRx coupons. And when they do that and don't get a drug plan, then what will happen in the future, if they want to add one, they can only add one during the open enrollment period, but for every month they went without, there's a 1% penalty added to their drug plan for life. And so my encouragement is always, even if you don't take any meds or you take cheap meds, still get a drug plan. You can get them as low as $7 a month. And so get a drug plan so you can avoid those penalties. Really, the biggest risk for not having a drug plan is if you need a real expensive medication and you don't have a drug plan, you're going to have to do everything you can to get that medication. It will be very, very expensive. You get a drug plan with Medicare, you'll pay a fraction of the cost. So it's always good to get a drug plan. If not, you'll be penalized. But the good news is you can always switch them or add those during open enrollment period. All right, and so I hope that helps. So we've seen the enrollment periods for A and B and the enrollment periods for buying other insurance products. And so you have to take action. You have to make decisions during this window of time that Medicare allows you to do so. Now, folks, I know this can be confusing. And so we and other companies who do what we do offer services to be able to assist through this process. And so just real quickly as I close out, number one, I want to make sure you know that MedicareSchool.com, we are independent brokers. We are not captive agents. Captive agents means they work for one insurance company only. We don't. We write insurance products for all the companies, but we're not captive to any of them. So we get to pick and choose and lay the plans side by side and compare premiums and coverages to make sure our clients are having the very best coverage. And number two, we will give you all the initial guidance that you need. Some people ask us to do a lot for them. They want us to help set up the myssa.gov account. They ask us to help them enroll into Medicare A and B, sometimes even start their Social Security at the same time. But whatever paperwork and red tape that we have to go through, we'll give you that initial guidance to make sure everything is being set up on time. Some of you are high income and you're going to want to appeal your IRMAs. Helped a couple of those cases today. But the whole point is anything you need to be able to make sure that your Medicare decisions are being done at the right time, we will do that for you, including enrolling into Medicare and Social Security. And then we also give ongoing support. Certainly you can call any insurance company. Was going to give you an 800 number on the back of the card. But you never really know what you're going to get when you call in. So that's why we have our own customer support advocates. And so our clients, when they have a problem, they can call us direct, and we can certainly get involved as their broker. And then, as always, there's no cost at all for the services. Agents cannot charge you for Medicare planning. The insurance companies always pay us our commission. There's no extra cost for you, no added cost, and the price is established by the insurance company, not by us. So you can't save yourself any money by even going direct with them. So no cost for our services, and it'd be our privilege to help you. A couple ways you can actually reach out to us if you'd like. You can go to MedicareSchool.com and actually set up an appointment with one of our guides. I just want you to know that I've trained all of them. I know them all personally. I work with them each and every day, and they're really fully equipped to make sure that they're taking great care of you. And you can also call our 800 number, 864-8890, and we take live calls throughout the day. We're open 7 to 7 Central Time, Monday to Thursday, and then 7 to 6 on Fridays. But you can reach out to us to be able to get some personal help, one-on-one help. And what we'll do is make sure we understand your situation, to guide you through the process of making sure you're going to Medicare at the right time. And then other insurance products that you'll need, we'll look at all the options and compare all those, and then show you the different prices and such as well. But it'd be our privilege to be able to help. And be sure, give us your comments, folks. We really want to hear from you. And again, any questions that we'd have, Daniel, that I should cover here before I close out tonight? Are we good to go?
Steve asked, do you have a window for Part D?
A window for Part D, yes. Well, okay, so Steve wrote in one note, do we have some kind of a window for Part D? So Steve, we do. And so if you're going to come in at 65, that window is the same 7 months that we're able to enroll into Medicare. We also can enroll into a Part D plan. And so the way that would work, let's keep it simple. Let's say that you're going to start your Medicare July 1. If I enroll into a Part D plan, April, May, June, my coverage would have started July 1. If I enroll into a D plan in July, they're going to start me in August. In August, they start me in September. September, they start me in October. So that's the latest that we want to enroll, would be that 3rd month after your birth month, because it's going to start the very next month. So again, we went without coverage, but there's no penalty as long as we roll into a drug plan during those 7 months. If I do not, then what happens, I can add a drug plan at a future date, but I can only do it during those dates of October 15th to December 7th, and my coverage won't begin until January 1. And so let's suppose right now someone not enroll in a drug plan, their initial enrollment period is over, they would not be able to add a drug plan until later this year, and they would not have coverage until January 1, and they would be penalized. All right, so that's the window for starting at 65. Now, if you're going to come into Medicare at a future date because you or your spouse were working, then again, we're going to come in using this special enrollment period. And again, we can do that 3 months before you're actually going to retire, or we have 63 days after that retirement date where we can still add a drug plan with no penalties, no problems. But you don't have a drug plan after retirement more than 63 days, then again, you're bound to only add it during the open enrollment season, October 15th, December 7th, with coverage beginning January the 1st. And if I go without, again, I'm going to be penalized. So those are the windows depending upon your situation, Steve. Daniel, is there anything else? All right, that sounds good. Please reach out to us. Terry Yancik, some of you reach out to her. She's very helpful, and she'll answer some of your questions as well. And again, keep in mind, every Thursday I do a Q&A because we get questions all the time, and so I take those, and we'll announce to our group when that's going to be on Thursday. And then again, next Monday, we'll have our Medicare Monday. But we'd appreciate very much. You can just be a part of our group and tell those about us. And our whole goal is to make sure that you have confidence when you go on Medicare that you're making the very, very best Medicare decisions. Thanks so much.